I'd like today to talk to you about continuing care services in Alberta. There are a number of continuing care options available to Strathcona County residents, and the supports are dependent on your individual healthcare needs. Any Albertan can receive continuing care services no matter of their age, diagnoses, or the length of time that they need support, as long as you have a valid Alberta healthcare card. If you are new to the province, you may still access these services. However, there may be a fee to you until you meet your residency requirements. Eligibility is based entirely on a professional assessment of a person's unmet need for care. In order to arrange for an assessment, you can contact HealthLink at 811. Continuing care services include assistance with dressing, eating and bathing, meal preparation, wound care, medication administration, respite, and various other healthcare and support services. These services and supports may be provided in your own home, in community-based service locations, such as adult day programs, and residential care facilities, which include designated supportive living and long-term care facilities. The Homecare program provides personal care and healthcare services for residents of all ages who live in their own homes, in seniors' lodges, or in some supportive living facilities. The Homecare program through Alberta Health Services helps people to remain well, safe, and independent in their homes for as long as possible. The service you receive may be short-term if you're recovering from an injury, an accident, or illness, or maybe a long-term basis due to chronic disease or aging. Health and personal care services provided through the Home Care program are publicly funded and provided at no cost to eligible Albertans. Supportive living is the next level of care where you can remain as independent as possible in a home-like setting while still having access to the services that you need. Supportive living may include seniors' lodges, group homes, and designated supportive living accommodations. Operators of supportive living sites will set their own rent prices and determine what services they offer. To determine if a supportive living site is what you want and need, it's best to meet with the operator, tour the accommodation, and talk to other residents living there. Designated supportive living is another type of supportive living available. Some facilities include both regular supportive living and designated supportive living spaces, but Alberta Health Services determines access to the designated supportive living spaces only. Professional health services and personal care assistance for residents of designated supportive living are publicly funded, and facilities are operated either directly by Alberta Health Services or by contracted care providers. The amount and type of care provided to residents is based on their assessed unmet care needs. The residents of designated supportive living receive 24-hour on-site scheduled and unscheduled personal care and support services from healthcare aides and licensed practical nurses. Now, you might be wondering how designated supportive living is different from regular supportive living. One of the ways is through access. Alberta Health Services determines access to designated supportive living spaces and requires individuals to be assessed by a health professional to determine their unmet needs. Access to other types of supportive living is determined by the operator themselves. Another difference is accommodation charges. The maximum accommodation charge in designated supportive living and long-term care is set by the Alberta government. In regular supportive living, the accommodation charge or rent is set by the operator. All designated supportive living accommodations provide 24-hour funded healthcare and personal care support on site. In other types of supportive living, accommodations have varying levels of health and support services available on site. Long-term care is a type of continuing care accommodation for those people with complex medical needs who are unable to remain safely at home or in a supportive living accommodation. Long-term care is provided in nursing homes and auxiliary hospitals, both of which may be referred to as long-term care facilities. In long-term care, residents receive accommodations, meals, and access to 24-hour on-site professional nursing and personal care services. The case management, professional nursing, rehabilitation therapy, and other services are provided by on-site staff. Long-term care healthcare services are publicly funded, and facilities are operated either directly by Alberta Health Services or by contracted care providers. The maximum accommodation charge that residents can pay in long-term care accommodation is set by the Alberta government. For more information on continuing care services in Alberta, please contact HealthLink at 811 or visit www.alberta.ca for more information.